to CSR. It lowers the deductible, out-of-pocket maximum, and your co-pays or co-insurance on silver plans. And there's different levels of that depending on your income. So the lower your income, the more of a reduction you can get in those costs. After you fill out an application with the marketplace, it will say whether you qualify for those extra savings. But you have to get a silver plan in order to see those. So I always strongly recommend you look at those first. They can be even better than the gold and platinum plans, but still cheaper. And then past that, the major things to be looking at are your deductible and out-of-pocket maximum. And then consider, what are the key things that you need from healthcare? Are you most concerned about some of your specialty medications or specialist doctor's visits? Are you having a baby and need to consider the costs of, tests and labor and delivery? Make a list of the top things you expect to be using your health insurance for, and then look at the copays and coinsurance for those under each plan. And then, of course, consider the out-of-pocket maximum alongside that as well. If the copays are a little higher, but that out-of-pocket maximum is much lower, that may still end up being a better deal overall. Those are kind of the main things to look for.
And what are the deadlines for the ACA?
The deadline for the ACA is you have to enroll and select a plan by December 15th for a plan to start on January 1st. And you can enroll by January 15th for a February 1st start date. So open enrollment is continuing until January 15th, but if you need a plan starting January 1st, which most do need that plan, make sure you enroll by December 15th.
And Diane from Just Care and Social Security Works, what should we be looking for in terms of Medicare to make sure that you get a plan that meets your needs?
Lots of things. So just to piggyback on what Zoid was saying, if your income is low, you may be able to take advantage of either Medicaid to pick up your premiums or a Medicare savings program, which is also available through Medicaid. And lots of people don't really appreciate that there's this help available when it comes to costs. So definitely, if your income is under 200% of poverty, you should be looking into those programs. In addition, and this is where it gets really complicated, in addition to sort of thinking about what you're going to need in terms of your health care, the drugs you're going to take or the doctors you're going to see, you want to think about the fact that healthcare is not only about today, it's about tomorrow. And tomorrow, a lot can happen. We all have seen people facing, horror stories out of left field unexpectedly. So what I always say is that if you want to pick a health plan not only that meets your needs today, but that will meet your needs tomorrow. So from the today perspective, you want to look at the drugs you're taking and go to the Medicare Part D plan finder, or call your state health insurance assistance program where you can get free guidance and see which of the health plans covering prescription drugs is best able to keep your costs down. Even if you're in a Medicare Advantage plan, a private health insurance plan that offers Medicare benefits, you might want to switch Medicare Advantage plans to get cost savings on your drugs, because each of those plans is connected to a drug plan, but some of them, again, will charge you more and some of them will charge you less. I also say to people to look really carefully at the differences between traditional Medicare, the government administered health insurance plan, and the Medicare Advantage plans, which are administered through health insurers. And the reason is because what traditional Medicare offers is the ability to see almost any doctor in the country and use almost any hospital in the country and get coverage. And there are very few obstacles to care, administrative obstacles, very few prior authorization requirements and other hassles. In the Medicare Advantage plans, you have restricted access to doctors and hospitals, and there are many financial and administrative hurdles. So why would anybody go to Medicare Advantage? Well, there is a reason, and that is that Medicare Advantage plans have an out-of-pocket maximum. And so you are protected financially after you spend is typically about $5,000 a year out of pocket for in-network care. Whereas with traditional Medicare, there is no out-of-pocket cap. And so you need to buy supplemental coverage, and that can easily cost a couple $1,000s a year. And, that's a lot of money. So I think a lot of people are almost forced to switch to Medicare Advantage in order to avoid having to pay for supplemental coverage.
And what are the dates that people with Medicare should keep in mind?
Okay, so another great question. You have until December 7 to choose a Medicare plan for next year at beginning January 1. And even if you're already enrolled in Medicare, if you're in a Medicare Advantage plan and want to switch to traditional Medicare, or you're in traditional Medicare and you want to stay or switch, you can do any of that switching until December 7th of this year. And then you do have some time in the new year, if you're unhappy with your choice, just to disenroll. And for more specifics on the rules, I think best you call your state health insurance assistance program for free guidance to meet your personal needs.
And that's a good point. So if you pick our plan, are you locked into that plan? And if so, for how long? For Medicare, you have another chance during open enrollment next year to change it.
Yes, and you have in a bunch of different situations, you also have a right to change. So if you happen to be in a Medicare Advantage plan and your doctors leave the network, and so the doctors who you depend on are no longer covered, you have a special right to switch. And there are other situations, for example, if you move, or if it's your first year of coverage in Medicare Advantage and you want to leave. So don't assume you're locked in. Contact your state health insurance assistance program and see if you have a right to leave.
And Zoid, what about the ACA? If you sign up now, are you locked in until open enrollment next year?
So you're not necessarily locked in. First thing to keep in mind is that you still have until the end of open enrollment to make your decision. So if you go and enroll in a plan today on November 15th, but then you do some more research or you change doctors, and on December 15th, you decide that you'd rather go with a different plan, you can still do that. And it will still start on January 1st. Also, if throughout the year you experience a qualifying life event, you can change plans. Those are a specific list of events that you can find on healthcare.gov, but they are things usually related to moving or changes in your household or income. So if you move to a different county or state, and so you gain access to different plans or lose access to your current plan, you can change. If you have a child, get married, or if you have a change in income that changes your eligibility for the tax credit or the cost sharing reduction I was talking about earlier. So let's say you were eligible for that cost sharing reduction, so you went with a silver plan, but then you had an increase in income and you no longer are. In that scenario, you'd be able to change plans, and same as the opposite. Your income lowers, you want to take advantage of a silver plan, you can do that. Sometimes with these events, you are restricted in which plan you can change into. Typically, you have to stay within the same metal level, or for example, if you're newly eligible for that cost sharing reduction, you'd have to move into a silver plan. So that's something to keep in mind. You can't necessarily jump up from a bronze plan to a gold plan just because you got married. It depends on your event, and you can find more details about that on healthcare.gov. And then also on Health Sherpa as well, we have some information on that.
I just want to pick up on one thing Zoid said, which is really smart, which is that if you sign up for a plan and then decide, oh no, I made a mistake, it's not too late to switch. You have until the last day of the open enrollment period to switch to a different plan. And you can keep switching until you feel you're comfortable with the plan that you've elected. And one other piece of advice, just because it's been out there in the news a bit, which is if you're watching Joe Namath or another older celebrity on television telling you that you need to call the Medicare helpline for free help on which plan to choose, I really would advise you to take, if you do decide to call, to take what they tell you with a grain of salt and not trust it entirely, because the Joe Namath ads and other ads featuring celebrities can be very misleading for people. They are not Medicare government sanctioned ads. They are corporate ads designed to get you to sign up with a plan. And you want to make sure that you get the plan that's best for you and not the plan that's best for the company that's making money off of your enrollment.
Absolutely. And what if you're on multiple medications that cost you several $100s a month, even with insurance? What can you do to bring down your drug costs? Zoid?
Yeah, so there are a few different things that you can do. I say this a lot, but first step should be to talk to your provider. Not some doctors will be more helpful with this than others, but it's always a first place to check. You can bring in a copy of your plan's drug formulary if you need to. You should be able to find that online on your insurance website. Look at the drugs that you take with your doctor and discuss that if there are any other options that you might be able to try. I know changing medications is not something you want to do lightly. And most providers do try to start with less expensive options, but since every insurance plan can be different in terms of where the drugs fall and how much they are, it is worth discussing that with your doctor, letting them know, I actually can't afford this medication, so it's not helping me. Your doctor will want to help you with that because, they're there to look out for your health. And of course, only make that kind of decision with your doctor. If any of your drugs are not being covered by your insurance at all insurers do have a process for getting a non-formulary drug covered. So a drug that's listed as not being covered. Usually that involves your doctor filling out a form or sending in a letter saying, we tried other drugs that are on your formulary. They weren't effective. They had severe side effects. My patient is allergic, and can help advocate for you to get that medication covered. And sometimes an attentive and knowledgeable pharmacist can also be very helpful in that situation. And then many drug companies do have assistance programs and copay cards. That's always worth looking into. There are online resources for finding those. I think we have a link to one through Just Care USA on act.tv/care talk. And there's also medicineassistancetool.org, where you can put in your age, what kind of insurance you have, the medicines you're on, and it'll show you some programs that may be able to help you. And then lastly, since we are in open enrollment, drug formularies change every year, insurance plans change every year. It's so important to actively shop and renew your plan. Even if you're satisfied right now, check to see if anything's changing. Look at the drug formulary for 2022. That should always be part of your annual process.
And what about for Medicare, Diane?
So I second everything that Zoid said. I think that's all really important. And often doctors will, if you go to them and say, I just can't afford all these drugs, be able to maybe reduce the number of drugs you're taking to also reduce your costs that way, or to switch you to a lower cost generic drug. So really important to talk to your doctor. And then really important to look carefully at your Part D prescription drug insurance plan options, because you can save literally hundreds of dollars by choosing one over another, depending upon the drugs you're taking. And then I just want to add, Kaiser Health News had a story not that long ago about how millions of Americans actually buy their drugs abroad. It's not legal. But nobody has ever been prosecuted for importing drugs for personal use. And there are verified pharmacies that you can go to where you can literally get your drugs at a 10th or 100th of the price that you would pay in this country in some cases. Not to do lightly, but if you're desperate for a drug, it is something that millions of Americans do. And then finally, I wanted to say there is some good news, it appears, ahead for people with Medicare with regard to their out-of-pocket drug costs. It looks as if Congress is going to put an out-of-pocket cap of $2,000 on the Medicare Part D drug benefit. So that will help literally hundreds of thousands of people with Medicare who have astronomical drug costs. Still $2,000 is a lot of money. I completely appreciate it, and it's still way too high, but it would be a huge help and allow a lot of people right now who can't afford to pay the copays to finally get the drugs they need. And in addition, it is also looking as if Congress might cap drug costs for the 60 most expensive, most popular drugs in Medicare over the next several years. And that also will be saving you some money. And if the law works the way people are saying it will, even people in the state health exchanges and with employer coverage will get to benefit from these lower drug prices. But nothing has been enacted yet, and so time will tell. And I know we've talked about having a special episode on what's in the reconciliation bill once it passes. So more then.
Absolutely. We'll be talking much more about Build Back Better. So let's talk now about premium prices. Zoid, how are things looking for the ACA for plans next year?
Yeah, so overall, things are actually looking pretty good, believe it or not. So some of you may know that there was a huge spike in the prices in 2018. This was due to a couple of different policy reasons that I won't get into right now, but for sure can in a future episode if folks are interested. But prices have gradually been going down since then. So the gross premiums, or what folks would pay before receiving any sort of tax credit, they have gone down. I lost the exact percentage, but a few percentage points. And then the net premiums, so what folks pay after tax credit, has gone down significantly because of the subsidies that were increased with the American Rescue Plan Act, which are continuing through next year, which may continue even further with the Build Back Better bill. So through Health Sherpa, our medium net premium that we're seeing is around $18. So most average of $18, or median rather. And then healthcare.gov, their data is saying that about 4 out of 5 people can find a plan for under $10. So if you haven't been able to afford the plans in the past, things have changed. They're continuing to change. So it is definitely important to go and look and see what you're eligible for now.
But I have a question, Zoid. If you don't qualify for a premium subsidy, are the premiums that low, or do they get significantly higher?
So they're significantly higher if you don't qualify for the tax credit. I don't have an average. Let me see. So the average benchmark plan, which is the second lowest cost silver plan for a 27-year-old, is about $368 a month. And so that's a 27-year-old. It's going to be more expensive as you get older. And again, that's average. It really varies throughout the country. A lot of folks do qualify for that tax credit. There are various reasons why you might not, aside from income. But yeah, they are. That's what they are.
And what's going on with premiums for Medicare, Diane?
Well, they were just announced, the new premiums. So let me put them in context. The good news is, first, that Social Security benefits are going up for next year by an average of about $90 a month. The bad news is that the Medicare Part B premium is going to eat into a chunk of that. Because the Medicare Part B premium, the standard premium, is going up to $170.10 a month. So that's a big uptick for people. And that is, interestingly, going up that high because of one drug that is likely to be approved by the federal government to be covered under Medicare Part B, that has never been covered before. And that is a drug for Alzheimer's disease called Aduhelm that has actually not been proven to have any clinical benefits yet. And it's not clear that it does have clinical benefits, but the FDA has approved it for certain people with Alzheimer's. And as a general proposition, the government tends to cover whatever drugs the FDA approves. So this is one of these situations where here we have this drug that actually is going to cost more than $50,000 a year and has no proven clinical benefits yet. That will drive up Medicare Part B premiums for everyone if the government, the Centers for Medicare and Medicaid Services, approve it. And yet, obviously people with Alzheimer's want to have access to drugs that can help extend their lives and improve their lives. But at that price, because the government isn't regulating the price of the drug, it is really a huge financial burden for everyone with Medicare if CMS does end up approving it.
And a question from our viewers. Mario says that Medigap supplements cost over $200 a month. It's become unaffordable for retired couple. Diane, do you have any advice for that situation?
Okay, let's start with the fact that it is unaffordable to a lot of people, as are the out-of-pocket costs in Medicare Advantage. And this is an increasingly big problem for people, everyone with Medicare. I mean, you have the choice of buying Medicare supplemental coverage, which is often unaffordable, or taking a gamble and going into Medicare Advantage and not being able to afford the deductible and copays and not being able to access the care you need there either. The simple solution obviously would be for the Congress to regulate prices more than it currently is. Medicare hospital and doctor prices are regulated, but other services, treatments under Medicare are sometimes not, and that drives up costs, like Aduhelm, like drugs. But with Aduhelm, just to say, that's a Part B, that would be covered under Part B of Medicare. That's a drug. And as I mentioned, Part B premiums are going up. That would also mean that the Medicare sub costs would go up as well. So $200 today might be $250 next month. One option would be to see if you could buy a Medicare supplemental plan with a deductible, a bigger deductible, which would reduce the premiums, but you would still be liable for the deductible. So there's no really getting around that unless you qualify for Medicaid, which would avoid your needing to have to buy a supplemental policy, or possibly a Medicare savings program. So definitely check. If your income is low, even if you think you're over the qualifying level, you might not be. There are sometimes deductions that you might not be aware of. So definitely look into that as your best option.
Okay. And this question is from Shelley. I'm a trans woman who is about to get facial feminization surgery, which is covered. However, my surgeon has suggested Botox injections for even better results. Are there insurance companies with plans that cover these injections? I can get letters from my surgeon and therapist that say they are necessary. So Zoid, what would you recommend?
Yeah.
The ACA.
Yeah, first of all, Shelley, I'm so happy to hear that your surgery is covered. We've come a long way in this country in terms of getting more coverage for transition-related healthcare, but we have a very long way to go still, so it's always nice to hear. I have a few different thoughts. It's hard for me to give specific advice without knowing which state you're in and what kind of insurance you have, but I have a few different recommendations. Again, I said it before, talk to your surgeon or their office. They might have some recommendations of how to get this covered by insurance. If they're having you go to a different clinic for the Botox injections, then ask which clinics they refer to and then call those clinics. Second, since you said that you can get a letter saying that these injections are medically necessary for your transition, your current insurance may cover them. It's not for sure. It's kind of a misconception that insurance will cover anything as long as it's medically necessary. Unfortunately, that's not true. However, depending on their policy, these injections may qualify. According to, the current laws, which are not always followed to the letter, but according to how things should work right now, if your insurance company would cover a service or medication for a cisgender person's medically necessary care, they have to cover it for a trans person as well. And there are medical uses for Botox, so those injections may fall under that category. So I would recommend speaking with your insurance company. And if you're going down this road, simultaneously also look into the appeals process for your insurance company. On our website, we have a link to Just Care USA's guide for appealing a denial. There's also the Patient Advocate Foundation has a downloadable PDF that talks all about how to file an appeal with your insurance company. And these are just, in general, useful information for anyone to have, but especially if you're anticipating you might get some pushback. And then lastly, there are different charity and mutual aid organizations that help trans folks transition. I don't know if they would cover your specific situation, but I also want to share these for any other trans people that may be listening. Point of Pride has an annual surgery fund, and applications are open until the end of this month. Gender Bands has transition grants and are accepting applications until the end of this year. And then there's also the Jim Collins Foundation. Their 2022 grant cycle is closed, but their cycle for 2023 will open in May.
Thanks. And we've run out of time for today, but we will be back a week from today. No doubt we will be talking much more about Build Back Better, especially if there's been a vote by then. We'll cover more in depth what's in it, and we will keep answering your questions. So thank you for caring, and this is Care Talk.